Okay, hi. This is Dr. Minkoff, LifeWorks Wellness Center. Along the way, I never thought that I would have to learn dentistry or biological dentistry because the general rule is that doctors avoid the mouth and dentists avoid the body. What I've learned is that 50% of the problems that we see in bodies is coming from the mouth. And those problems have to do with poor teeth hygiene, with root canals, with gum disease, and that complementing us are dentists who understand the same thing. And between the two of us, we can get the bodies better when we've gotten the mouth better. Now, sometimes people have had dental work done where the teeth aren't any good and they got to go. So if the tooth is dead, if the tooth is infected, if a procedure called a root canal has been done on a tooth, these are all incompatible with good health. And so sometimes these teeth need to be pulled. Now, I hate to pull teeth, but a dead infected tooth is worse than no tooth, and they just have to be pulled. So these teeth are a liability to the person, and they have to go. So now the problem is you have to have teeth. And what do we do about those teeth? Now, sometimes the dentist can do bridges. So if one's missing, he can bridge the two on either side. That's fine. Sometimes he can put in a partial so that the gap is fixed, and that can be okay. And sometimes the dentist has to do implants. And implants are basically a screw that's put into the jawbone, and then you can anchor a tooth to it, and it can function as a tooth. Most implants that are done are made out of titanium. Titanium is a metal. It conducts electricity. And we're in an electrical world right now. Like there's electrical Wi-Fi everywhere. And sometimes those titaniums pick up that vibration and they can have a negative influence on the body. There is a newer version of an implant which is called zirconium. And zirconium is like glass. It's not metallic. It doesn't conduct electricity. And these they make diamonds out of zirconium. The fake diamonds can be made out of zirconium. It's very hard, it's very durable, and it's not electrical conducting. And so the biological dentists that we generally refer to use these zirconium implants. And they have long duration, they last really well. They can be put in, and then you can get a crown that's put on top of them, and they can function well as teeth. So I leave the dentistry and that part of it to the dentist, but we found that people who get their bad teeth out and then new teeth in with the zirconium implants, they do just great. And the body's very compatible. Titanium or the zirconium is non-reactive to the body. It doesn't accumulate anything. It's inert. It just stays there. And so it seems to be very safe. And when we do energetic testing on the bodies seem to be fine with it. They don't have any problem with it. So if you need dentistry done, there are a few really good biological dentists. We work with them here in Clearwater, and they will, if you need an implant, they will do a zirconium implant on you, and you can rest assured and be comfortable that this is a good solution so that you have teeth you can chew. You need teeth. You got to be able to chew. You want a nice cosmetic effect. And implants with zirconium are a really good solution. So I advise people to do that. And then they get their mouth health back. And with their mouth health back, they get their body health back. Hope this helps.